November of 2013, a group of 12 students and 3 instructors from various campuses of West Coast University went to Costa Rica to participate in a public health initiative.
This was the type of experience where we went there to give to the people, but what ended up happening is that we received much, much more.
The purpose of this initiative was to provide health care and to reach a large population of the Costa Ricans, and also to provide education to this population.
The culture was definitely unexpected. I didn't know that they're such friendly people.
In order to function better as a nurse in Costa Rica, I had to adapt my behavior in several ways. I am naturally pretty reserved, and we discovered that Costa Ricans tend to be pretty shy, so I had to overcome my own shyness so that I could be more outgoing and reach out to these people so that they could better communicate with me and be open with me in order to provide better health care for them.
I was actually really surprised by just their whole healthcare system. They have to see at least every person once a year, so they will walk in the community and actually go to people's houses. They will give the immunization right there at their house, which I thought was amazing. They were so advanced in their practices and at times knew more than we did when we were there. So it was just surprising because I went in there thinking, oh, we're gonna teach them this and that. And honestly, I came back with more knowledge about their healthcare and more knowledge to bring back to the United States than I did going in.
We had a tour guide, and he was explaining Costa Rican history, and he was talking about immigration. And we have that same issue where immigration, illegal immigrants are in our country. Here, we don't offer them health service. The only thing available to them is emergency service. There, because of their open and friendly attitudes, they see them not as a problem, but as the person itself. There they have the Nicaraguans that go there, and they're illegal immigrants and they're working, but they still need healthcare too, and they still provide it to them.
The health disparities that I observed in Costa Rica pertain to the different social classes. Costa Rican citizens and the residents of Costa Rica are all entitled to their public health care. It's a socialized healthcare system, but it does have its flaws, and so a lot of the problems are present in the timeline. People are given access to diagnostic services and whatever healthcare they need. It's just a matter of how soon they can get the healthcare. So the disparities that I saw was that people that were more affluent and could afford to would turn to the private sector and seek healthcare in a private manner and not have to wait the whole long term that it would take for them to get healthcare through their public system.
One of the things that we did in Costa Rica was home health visits. And I do home health here in LA. And one of the unique things about home health is that you get to see the different levels of how people live. But when we did it in Costa Rica, it was mainly in areas where it was very poor, poverty-stricken. And just seeing that level of poverty, but that they're still able to access healthcare, was pretty interesting, because here that's a big issue, and that's one thing that I got to see personally. One of the most enjoyable things was doing education to the children when we went to the primary schools, because there they actually soaked up the information. We did activities with them. It was fun seeing the smiles light up on their faces and just getting involved in the activities.
I know that I was teaching preschool, first, second, and third graders about general hygiene, and I remember standing up there, I'm like, how am I gonna do this? I don't speak fluent Spanish. But I found the way. I think, a universal communication, like a simple smile, a handshake, a hug, is just another way of communicating. You don't necessarily need to know the language fluently in order to get your point across, or, show your kindness. It felt good. It really did, because I knew why they were there. But whenever I would see them smile or get happy over the littlest things, like giving them a balloon or making them like a bracelet or something, and they would just be so happy. And I think there's no better reward, no better feeling.
Going to the hospitals was also interesting because their hospitals are not like ours at all. They have primary, secondary, and tertiary levels of care, and we went to a secondary level, and that housed like 9 doctors in one unit that would see over 100 patients just in that morning. You know, I see with Obamacare and healthcare reform, we might be moving towards that kind of model in the future.
My biggest experience there that had the biggest effect on me was when, during one of our free clinics at the local community, a mother brought a son to the clinic who had an ear infection, and the mom already knew that the son has the ear infection, but she couldn't afford for the treatment. I think we are fortunate enough in US to have that opportunity to walk to any clinic or any emergency room and be able to get treatment without worrying about financial needs. Sometimes we still complain about how long we have to wait in the emergency room to get treatment, but at the same time, that's not important. The important part is to get treatment and help people to overcome their diseases. My perspective on life has changed since the Costa Rica experience. I'm more thankful and appreciative of what I have. Sometimes we take for granted for the stuff we have and the resources we have in the United States. And just being in Costa Rica and being able to experience the cultural differences, there are so many other small factors that we don't even consider. We always complain about the things we don't have. I think we need to step back and just appreciate what we have.
The United States, I mean, it's stressful, and we're always busy. We're always thinking of stuff, whether it be bills, school, you know, how to achieve the next thing. And over there, they just had such a calm demeanor. Even if they didn't have as much as what we have, they just looked at life in such a positive attitude. You could see just by the way they would smile that everything they did was so genuine, and they're just full of life. I mean, they always said pura vida, which means like pure life, and they lived by this quote, and they said it even as a hello, and they really lived up to it because all they were about was just pure life and just experiencing all the small things and enjoying the good times.
Going to Costa Rica impacted my life in a different way that I never thought was possible. Beforehand, I had this whole plan of what I wanted to do and how I was going to accomplish it. But afterwards, I saw the great need for public health nurses, and I could definitely see myself doing that in the future. And now it's gotten me to think about what I have to do to get to that spot in life.
The people of Costa Rica ended up teaching us life lessons that I feel like we will take forever in terms of our professional lives as nurses and in terms of just humanity in general. There is a different way of life. We don't need to worry ourselves sick, and we don't need to be focused so much on working. There are things that matter so much more than that, and the people of Costa Rica showed us that just by their demeanor, just by observing them and being and living among them for 2 weeks, absorbing their culture and their personalities and their happiness and satisfaction with everything has impacted me personally, and I feel like everyone else that has participated on this mission in so many ways.
It was an amazing experience. It's something that I will never forget. I'm very thankful that I was selected to go on this trip because it has made me look at life, my family, the things I have, my colleagues, everybody in a different way.
And when I got to Costa Rica and was caring for the people there, it was much more holistic, and it was much more of making sure the whole person was okay and relating to them on a personal level instead of just seeing them as patients, getting whatever tasks needed to be done, and instead treating the person as a whole.
The 2 weeks that I was there, I felt like I lived. I didn't just exist.
It was an eye-opening experience that I was grateful to have.
During our health screenings, we'd see over 100 people, And within that group of people, we would catch 3 or 4 people who needed to see a doctor right away. By providing the screenings, we were able to catch it in an early stage so that we could prevent further complications from occurring. And it was sometimes they might not have even known that they were sick or it was even heading that way. And just knowing that we helped out those people made a big difference.
As a professional with my license, I could go back and participate in medical missions, which would then in turn shorten the timeline for these people that don't have the resources to seek private health care. They would be seen sooner and maybe have their diagnostic tests done faster or get their treatment done faster and not have to wait for the public health care system. These medical missions would save lives depending on what services they offer, but there are a lot of medical missions that provide surgical services, diagnostic screenings, and things as such that would be able to affect that kind of change in that population. We went out there with the intention of teaching, and it ended up being much more of a learning experience.
As a nurse, we need to be culturally alert, and I think Costa Rica was a great experience for this because people over there, they're always happy, friendly. They always have the big smile on their faces.
I believe that the things that we learned we will take into our respective lives and professions, and for that we are very grateful. We're grateful to the school for giving us this opportunity, to the instructors that accompanied us on this trip, and to Costa Rica for providing such a rich and diverse culture and population for us to learn from.